We're going to look at the exchange of oxygen and carbon dioxide in the lungs and also in the tissues. Let's look at gas exchange in the alveoli first. Oxygen and carbon dioxide are just going to diffuse down their partial pressure gradients across the respiratory membrane. And remember, the alveoli are really good at doing gas exchange for two reasons. The first is they have a really large surface area, and the second is the respiratory membrane is really thin. So it's very easy to get the oxygen and carbon dioxide across very quickly. So let's take a look at the surface area of the alveoli. So remember, it's really large. It's about the size of the area of a tennis court. So if you have a very large surface area represented by this purple line, you have lots of spots here where oxygen and carbon dioxide can diffuse across. And compare that to if you had a small surface area. You're not going to be able to get as much oxygen and carbon dioxide across if you have a small surface area. So a disease where we see a decrease in surface area of the alveoli would be emphysema. And remember, that's one of the COPD diseases. So chronic inflammation from smoking or exposure to air pollution, the chronic inflammation will destroy some of the alveolar walls, and that'll decrease the surface area, and now there's less room for gas exchange. And so these people will have trouble getting enough oxygen in and carbon dioxide out. The next thing that makes the alveoli really good at doing gas exchange besides surface area would be how thin the respiratory membrane is. So remember, it's only 2 cell layers thick. And if you look at the top right picture here, you can see the thickness of the airways as you move down towards the alveoli. The bronchi, notice that they're very thick-walled, so that's why you don't get any gas exchange there, and the same is true in the bronchioles. But once you reach the alveoli, there's only 2 cell layers that the gases have to go across, so it's really easy for them to do gas exchange. If you increase the thickness of the respiratory membrane, so maybe this person has left-sided heart failure, and you're getting more fluid being pushed out of the capillaries into the lungs. Or maybe the person has pneumonia and you've got a lot of inflammation and maybe there's some pus in here from the infection. Or maybe you have ARDS, which is acute respiratory distress syndrome. And that's something that we're seeing in some of these really severe coronavirus cases. And they get an overwhelming inflammatory response in their lungs. And so it gets really swollen and thickened here, and you got a lot of fluid buildup. And if that happens with any of these diseases, it's really hard to do gas exchange because now the respiratory membrane is really thick, and plus you've got some extra fluid in there. And so you can't get enough oxygen and carbon dioxide across. And so it feels like you're really having to gas for air and that you can't get enough oxygen when that happens. Let's take a look at gas exchange in the alveoli. And this will be easier if we look at a picture. Deoxygenated blood from the right side of the heart will be pumped through the pulmonary artery to the pulmonary capillaries. And notice that the partial pressure of oxygen is much higher in the alveolus than it is in the deoxygenated blood coming in through the pulmonary artery. So oxygen is just going to diffuse down its partial pressure gradient, going from high partial pressure in the lungs to low partial pressure in the blood. And oxygen will diffuse across until the partial pressures equilibrate. And then the same thing happens with carbon dioxide, except it's going to move from the blood into the lungs. So carbon dioxide will go down its partial pressure gradient from 45 in the blood to 40 in the alveolus. And carbon dioxide, again, will move across until the partial pressures equilibrate with what's in the lungs. And now this newly oxygenated blood will leave the pulmonary capillaries through the pulmonary vein and then be delivered to the left side of the heart to be pumped out to the systemic circuit and the rest of the tissues. So these graphs are just showing you that it only takes 1/3 of the length of the capillary to do all of the gas exchange with the oxygen and also the carbon dioxide. So you've got a big reserve, you've got some extra length there that when you're exercising and the blood is flowing through the pulmonary capillaries a lot faster, you still have plenty of room to be able to do all the gas exchange that you need. What I want you to notice about this table is there's a difference between the atmospheric air and the alveolar air as far as the partial pressure of oxygen and the partial pressure of carbon dioxide. So what you're breathing in the air ends up not being the same as what ends up in the alveolus. So there's a couple of reasons for that. The first reason is that you are doing gas exchange in the alveolus. So oxygen is moving out of the alveoli into the blood, so that's going to make the oxygen levels lower. And then also carbon dioxide is moving from the blood into the alveolus, so that will make the carbon dioxide higher than the air that you're breathing in. The other reason that there's a difference is that remember that when you breathe in, the air entering into your alveoli is not completely fresh air. So remember you have that anatomical dead space, that 150 mils of old stale air. Remember that enters into the alveolus first. So that has lower oxygen and higher carbon dioxide. So that contributes to some of the difference between the alveolar air and the atmospheric air. And then the last thing is that remember that you have 100% humidity in the alveoli. So that will decrease the amount of oxygen that's in the alveolus as well. Let's take a look at gas exchange of the tissues, and we'll look at a picture for this. The oxygenated blood in the systemic circuit is going to be brought into the tissues by arterioles, and then in the capillaries, the oxygen and carbon dioxide are just going to move down their partial pressure gradients, so going from high to low partial pressure. So oxygen is going to be much higher in the blood than in the tissue, so oxygen will diffuse from the blood into the tissues down the partial pressure gradient. And oxygen will move until the partial pressures equilibrate. And remember that the oxygen is lower in the tissues than in the oxygenated blood coming in because the tissues have been busy using up the oxygen, making ATP with their mitochondria. Carbon dioxide is going to move the opposite direction. It's much higher in the tissues because carbon dioxide is being generated as a waste product as the food is being broken down in order to release the energy to make the ATP. So 45 for partial pressure of carbon dioxide in the tissues will then move into the blood where the partial pressure of carbon dioxide is 40. And the carbon dioxide will move across until it equilibrates with what's in the tissue. And then this deoxygenated blood will enter into the venules and then be returned to the right side of the heart. This just shows oxygen and carbon dioxide diffusion side by side, and just showing you the partial pressures and just remembering that oxygen and carbon dioxide both just move down their partial pressure gradients. And this just shows the exchange in the alveoli and the tissues. There are several factors that affect the alveolar partial pressure of oxygen and carbon dioxide. The first one is the air that you're breathing in. It has a certain partial pressure of oxygen and carbon dioxide, and generally that does not change, that stays the same unless you're climbing a mountain and the elevation is really changing. So we're really not going to consider that one. But the other two, alveolar ventilation and the rates of oxygen consumption and carbon dioxide production, those can quickly change in the body. Remember that alveolar ventilation, that's just the amount of fresh air that's reaching the alveoli. And remember you calculate that by subtracting out that dead space air volume. So the reason that we are concerned about the alveolar partial pressure of oxygen and carbon dioxide is remember that's going to determine the arterial partial pressure of oxygen and carbon dioxide in the systemic circuit. Because remember in the lungs, that the oxygen and carbon dioxide are going to diffuse across until they equilibrate with whatever's in the alveolus. So normally we need to match the alveolar ventilation to tissue demand. So if you do start exercising and now your tissues are using a lot more oxygen, generating a lot more carbon dioxide, your breathing has to change to meet that demand. So increasing your ventilation to match the increased tissue activity, that's called hyperpnea. So pnea means breathing and hyper just means increase. So when you start exercising, you're going to start breathing faster and deeper, and that'll bring more oxygen in and get rid of more CO2, and that'll help meet the tissue demand. Make sure you know these respiratory terms. These will definitely be on the exam. We already went over hyperpnea. Dyspnea is the next term. Dys means difficult, so this would be labored or difficult breathing that you might see with someone having a severe asthma attack, or maybe the person has a pneumothorax. Maybe they've been stabbed in the chest and one of their lungs have collapsed. Apnea, A means without, so this is when you temporarily stop breathing. Sleep apnea would be a great example there. Tachypnea is rapid, shallow breathing. Tachy means fast. Hyperventilation means that you're breathing too fast to meet the conditions of the body. So this would be, for example, a panic attack. So you're not exercising and your tissues are not demanding more oxygen and telling you to get rid of more CO2, but you start breathing just too fast, and usually they take kind of shallow breaths during a panic attack, and so that's going to change your oxygen and carbon dioxide levels in a way that's not meeting the tissue demands. Hypoventilation is just the opposite, where you're breathing too shallow and too slow to meet the demands of the body. So for example, we could see this with maybe someone took an overdose of opioids. So that suppresses the breathing center. They're breathing too slow and too shallow to meet the demands of the body, and so that's going to change the oxygen and carbon dioxide levels in the blood, and that will cause some problems too. Hypoxia, oxia is talking about oxygen. Hypo means not enough. So hypoxia is not enough oxygen in the tissues. Hypoxemia, emia refers to blood. So hypoxemia is not enough oxygen in the blood. Capnia means carbon dioxide. So hypercapnia means you have too much carbon dioxide in the blood, and hypocapnia means there's not enough carbon dioxide in the blood.